Hey, welcome back to Liquid Lunch Show, where you're live on Bay Street in downtown Toronto.
Yes, where all the action
In real time, you can see the action behind us. If anything happens, let us know. There's a big bucket full of cement going back and forth. But we've got Mai-Yee, you,
Yes,
right? Mai-Yee?
That's correct.
Should we call you May or Mai-Yee?
Either or.
Okay.
I go by both.
All right. And are you a Chinese doctor
I am.
or a doctor of Chinese medicine?
I like Doctor of Chinese Medicine, but by regulations, we most of us call ourselves traditional Chinese medicine practitioners.
Okay.
Yes, or
All right.
acupuncturists.
Okay. Now you brought a whole bunch of stuff here today, but
I
let's,
did.
why don't you give us a little bit of an introduction to Chinese medicine, because it's probably still a bit of a mystery. Most people, I think most Canadians would go or normally go to see a Chinese practitioner, although
Right.
I've been tempted.
Well, you should. It's good experience, and it will benefit you in many ways. Chinese medicine is actually well known for as a preventative medicine.
Yeah.
So the idea is that you're treating yourself, taking care of yourself before you actually develop disease or ailments. But even if you do have a disease or pain or some kind of imbalance, right? Chinese medicine can help correct that. And the whole idea is between balancing the energies in your body, which we call yin and yang. They're opposites. So when your body will give you symptoms, or signs when there is something out of balance. So for example, if you have a headache, there's something out of balance internally, and something like acupuncture can help to correct that imbalance by activating certain trigger points in your body that will help give the body a sign that, okay, we have to get in there and treat this area of imbalance. For I could talk a little bit about like for example for cosmetic purposes, people who have wrinkle lines or just want to improve their complexion. Putting needles on the face will actually increase the elastin and collagen production, which will fill out, laugh lines or, crow's feet, around the eyes, and, then overall improve the complexion, and tone of the face.
Mm-hmm. Well, I have the immortality rings, right?
Mm-hmm.
These are magnets aligned a certain way based on principles of Chinese medicine.
Oh,
So
great.
you don't need to do any of the topical stuff if you wear these. You just live forever. And
Well, that sounds good. Then I'll just turn in my practice, and that's
no, you
I'll
just sell
get.
these rings.
Well, yes,
No.
I think a few needles might do you very well, and I asked you to bring some extra large ones
Yeah,
just
yeah.
to support your.
And she brought the fire. Now I see what you're talking about with the fire, Hilton.
Absolutely, and you're such a dynamic being, and because you have immortality, you don't have to worry about any type of mortality challenge. So
That's
you're
right.
the perfect person to demonstrate all of this on.
All right. So which part of my body do you want to set on fire today, Mai-Yee?
Well, I think the easiest probably your arm, if you want to expose the arm.
Well, you're going to set it on fire?
You prefer your left or right?
Let's do
Yes.
Okay.
If you leave your clothes on, I might set it on fire. Yes.
I
with
better
that-
if you
take them
roll up
off
your
right
sleeve,
away.
then-
I bet-
Just roll up
You're
your sleeve.
safe.
Yes.
What are you going to do? Stick a needle in my arm?
I could do that too.
Really?
Yes. Well, I was thinking
don't-
your ears, but
my ears? Really?
Yeah.
What are you going to do? Okay. Now, first of all, what do you have in mind here? Now I'm getting nervous. I got my arm rolled up and I don't know what I'm getting myself into.
Well, for the ears, your ears are actually a microsystem of the entire body. So there's just hundreds of points on your ears that can actually help correct imbalances in the rest of your body. So for example, you can treat headache with a point on the ear. You can treat indigestion also. But what I'm thinking is a protocol that we use for, mostly for addictions, either substance, behavioral, but for anxiety, depression, stress, that's trouble sleeping. It's just a protocol that's commonly used, worldwide
For
because it's
overall betterment, somewhere or
that's
wherever one
right.
needs
Yes,
it.
yes.
So
Absolutely.
do you have to do a bit of a diagnosis first, or
Nope,
do you just
but
stick
no.
a needle in and it's just going to help everything?
Yes. So the beauty of this because it's a protocol,
Yeah.
there's no diagnosis needed.
Okay.
It's the same 5 points on each ear for everybody,
Okay.
and that's why it can be so widely used.
So what do you want me to do?
So
Bring my
what
ear
I
over there?
If you please, or I
Really?
don't know if I can come over.
No,
Think I'm a
I'll,
little
I'll keep an eye on you.
Literally.
Okay.
Go you, go you.
Okay.
Yes, we have a brave soul.
Bit of encouragement there. Very great.
Behind. Oh, can you get behind me?
That way I'll be able to talk to
Okay.
your mic too.
All right.
By the way,
Yes.
whatever you're doing, well, I guess I can see it on the thing.
I'm just gonna swab.
Great.
Would you like
Remember,
both
smile,
ears
you're
or
on
just one
camera.
ear?
Hey, can I ask you something while you're doing this? 'Cause
Sure.
I've heard about this. That the ear is kind of like has all parts of the body
Yeah.
represented, and I wonder about people that get like their ears pierced, or and ow. Did you
Not
just
supposed
stick
to
a
say
needle
that.
in my ear?
There's a chair there if you wish you to
Oh, thank you.
He's good right here. There you go.
See, look how he's lighting
It
up.
looks great.
This is
see?
great. Look,
Yeah.
his complexion is improving.
There you
Relax
go.
and breathe.
There.
You
See, that's
breathe
so
into
bad.
it. There you go. Breathe,
Yeah.
relax. There you go. You're doing all right. Yes,
Okay,
all
well,
right.
we could do
Yeah,
the other
yeah, there you
ear
go.
to balance it
Oh, I
out.
gotta do the other ear now?
You know, it's not to get that easy. That
Yeah.
would be too
You want to
easy.
be balanced on both sides
Exactly.
here. Yes.
What? No, what's this going to
Keep
do
breathing
for
and
me?
relaxing.
Well, this will help,
Deep
just the
breathing,
overall
Hugh.
balancing of your body's functions, let's say.
I see a
So-
bit more blood flow in the neck and so his circulation is going.
Absolutely. He's
Good,
doing
good.
a great job here.
Yes. Yes.
One
Look
more.
at that smile. It's so
I know.
impressive.
Look at the color of the face.
Yeah,
I mean,
look, you
like,
see?
where else can you get that?
Breathe, keep breathing. Yes,
There
that's the
we
one
go.
key. You have to keep
There
breathing.
you go. Now you're all set. Beautiful.
Now what?
Now, do you want to have a seat and I'll do the cups?
Yeah.
What? There's more?
Now the
Oh
fire.
yes,
So have a seat.
You have your arm exposed there. Your arm is waiting for something.
Uh-huh.
Oh boy.
Hey, you're doing good.
You're doing fabulous.
If you breathe in and deep through and then release, it'll start to calm down.
That's
And you'll feel the
right.
flow and the balancing of your yin and yang.
Really?
That's yes. You may feel even increase in energy, right? Better sleep tonight.
That would be
Brain synapses are probably firing at 1,000% more right now.
Okay, so let's see. You gotta have your arm relaxed. This won't hurt. Oh, look at that. You have them attaching to you.
Well, those are the immortality rings.
Is there any danger if he was out in a lightning storm that the lightning would come and over amplify the
It's unlikely, but
There's fire.
Don't you love it when I
there
do these
is.
things
Look
for you?
at Isn't this?
There we go.
Look at that.
There,
Oop.
one.
Well, we lost that one.
There, okay, good.
Okay, well, we
Whoa,
got one
there you
there.
go.
Oh, look, how does that feel?
Yeah.
That feels.
That's
Doesn't
all-
hurt?
No.
No.
Yeah.
Well, the purpose of the cups, it actually helps to improve chi and we say chi and blood circulation. So
You're not
it's also a way to. It's also a good way to relax, tense muscles.
Are you relaxing?
Yeah,
Very relaxed.
there you are.
You're doing great, you.
He's doing very well. And there we have it.
You're done with the
Cup
fire
A.
already?
I know. It's not. Well, if it was his back, it'd be a bigger area.
Oh yeah,
so
you do
it'd be a
the
little different.
yes.
Yeah.
Can flame the
There you
whole
go.
thing.
It's not coming on.
It wants to stay there for a while.
Okay.
But yeah, and that's actually cupping is also very effective for bringing down fever. So whenever if you come down with a cold and you have a high fever, we do a little bit, we do a little bit of pricking. There's a point behind, the back here that will prick to bleed actually, and then put a cup and draw out that, excess heat from the body. And it's really effective actually. And traditionally, it's been used in, different countries around the world for that purpose. And then just drawing out the excess cold from the body. Commonly, it's also used for relaxing the muscles and improving energy flow and blood flow in blocked areas of the body.
So how long
So-
should I leave that?
Oh, well, usually until the section holds or, until the color changes in
I
your
don't
skin.
want to rush it or anything.
You want to get the full
Benefit
effect?
from the.
Well, I'll do a little bit
So
of
it's
a
like going
different
through all this
technique as
pain.
well. Yes.
So this is just
Keep your
drawing
mind
out,
off.
whatever is impure or in you.
Kind of like toxic energy. We
So
say.
it actually is just like a,
Energetically.
a clean out.
Yeah, it's detoxifying for sure.
So should I?
Okay. Yeah, just relax your arms. I see you have a fist.
Yeah.
This won't hurt now that you've tried it. So the flame actually never touches you, right? It's kept at a distance. So
Just transference.
So is this just what you're doing right now? This is just a tonic. Like almost anybody could have this.
Depends actually on people who bruise easily. Maybe caution about because it can,
Oh, by the way, I'm a hemophiliac.
Are you okay? Well, I'm not doing
No,
too
I'm
much
just
to you. The beauty of
going
Chinese
there for a
medicine.
moment.
I know it's
I'm
scary.
sure I deserve that.
Maybe I should have done the diagnosis. But yes, we definitely always start, if you're coming in for treatment, we always start with an initial overall intake. And that will cover pretty much every organ system, right? Because Chinese medicine treats at the root of disease and illness, which is I find most effective. But, it also is a complementary medicine as well. So, you can, if you're seeing a Western medicine doctor, then you can definitely also get treatment with Chinese medicine. And I find that the both work well together. Absolutely. So, see, how's that feeling? It's like a massage.
Yeah.
Yeah, cupping is quite like a massage. And then usually I like to finish up with some massage, which we call tui na. Tui means to push, and na means pull. And just working on different pressure points and different hand techniques. So
you're very much like a personal healing aid, just working with an individual body to
definitely
help it find its better ways.
Exactly. And a lot of it also comes from you get a sense of what the person needs. Like it comes with practice. And I find sometimes people will say to me, how do you know that that it hurts there, or how do you know that's what I needed, and sometimes it's hard to explain it because you just get that instinct, and you start to learn how to read a person.
So, if in reading
over
Hugh,
time.
are there certain things that you would see? I realize this is unfair because you haven't had real moments to to do this, but there are certain things that come to mind immediately.
Just offhand with
what you're
what's
sensing, and
I sense just usually people's stress levels. Like I can tell if somebody needs that kind of calming.
We need to send you to
But
Mexico.
not me. I'm very. Right.
Oh yeah, definitely.
No stress over here.
Not now with the needles in there. Like keeping your stress, right?
Now we know how to get you to behave. That's it.
Yeah. So the whole idea is if you find the root cause of kind of what the person's coming in for, then you can help the best with providing what they need.
Yes.
And for some people too, it's sometimes just talking to somebody that they can trust that can kind of give them some counseling. That's usually a big part of it as well. So combining different modalities, and according to what person comes in with.
Yes.
For sure.
Well, Mai-Yee, I've had the privilege of having you treat me as well. And so, Hugh, I'm not having you be a guinea pig because I did that first, and have a trust, because I found that one time when I had a massive headache and Mai-Yee was with me, I asked, is there anything you could do? And basically, 10 minutes later, all of that had reduced without taking any pills or anything. So, I just found the effectiveness, and it's like, oh, this is wonderful.
Okay.
So,
Well, that's. I thought
yes.
you must have some experience.
Yes.
You wouldn't put me through that if you didn't have
So
some kind of.
everything that you've experienced, in this regard, I have too. So you are in safe hands, and it's just it's surprising. I know for me to find that it can be so simple and immediate.
Yes.
And then the incident of when I've had that headache, it coming back, it didn't occur.
Yeah.
And a couple of other times when you assisted, again, just the effectiveness was quite strong. Is that seems to be one of the benefits of Chinese medicine?
Yes, you can get immediate effects. You know, of course, it depends on what it is. I've had people, you know, come back to me, you know, on the same day, and you know, after a treatment, and they tell me, you know, I've had the best bowel movement, you know, I've had it in a long time, and it's, you know,
I always
like a
love
few
hearing
hours.
that from people.
Well, yeah, there you go.
Yes. Thanks for releasing on my show.
Bringing in some funny talk here, but you know, things like that, or energy as well. Even mood. You know, mood is a big one. You know, somebody who's feeling very down or low, or you know, they turn around the next day and they said, oh my gosh, you know, I feel great, or you know, so there is those experiences where people feel immediate results. But you know, and again, Chinese medicine doesn't, you know, work for everything, you know, or most times it's people don't give it long enough of a fair chance to actually allow it to work, because you know, you do experience those immediate effects, but then there's cases where it's more chronic and it'll take, you know, quite longer time. So it all varies.
I really do want to get back to that question about the ears, though, because when I see
Sure.
some of these people today with the super, like, multiple piercings on their ears and stuff like that, and because I've heard that about the ear represents the whole body.
Yes.
When you see that, does that is there any like do you suggest people not do that, or are there any risks that people take by doing stuff like that?
It's interesting because certain points that are you know, pierced, they're actually on pressure points.
Yeah.
I can't say I know enough, you know, whether it's a good thing or a bad thing. I think it depends on, you know, on the point and what if that person has like a problem, you know, in that area.
But I think people are making these decisions without
based
any
on-
regard to what the possible impacts might be.
Right. So I would definitely, you know, look as a person, because like depends on where you're going to get piercings, right? Because the ear basically is like an upside down fetus. So you have your, you know, the head, the eyes, and the ear, the ears and mouth and, you know, tongue, you know, all in the lobe of the ear, and then it goes around to, you know, the stomach, and then you've got the legs and the arms, and you know, and then you have the internal organs like the kidney, the lungs are at the bottom, right, closer to the earlobe, and then you have the liver and kidney, and then the spleen and stomach, and et cetera, the heart, right? So you know, probably you know, they can discuss if they're, you know, very cautious about that. Discuss with like a practitioner or somebody who knows about the ear, and be able to explain to them, well, this is what you might be triggering if you're piercing that part of the ear. You know, that's what I would probably advise.
Interesting.
Is there an ideal patient or client that you like to work with, or certain areas that you really you know, encourage people with these conditions to contact you?
That's a good question, actually. I'm actually still kind of going through that myself, trying to figure out, you know, is there a favorite group I would like to work with, or you know,
Yes.
what is, you know, what am I drawn to? Right now, I'm running more of a general practice, so
Yes.
you know, which is kind of helping me to decide, you know, what my focus will be. I mean, you know, you don't have to, but you know, it is, you know, I guess you can have that choice, you know, whether you want to focus on one thing, or if you want to just, you know, run a general practice.
But I would think that Chinese medicine may offer some hope to people that otherwise aren't really getting the help they need from Western medicine. Do you want to
Yeah.
maybe mention some of the conditions
Sure.
that people might think they can't do anything about, but they might seek some relief through Chinese
Yeah.
medicine?
The biggest or the most common one that I see is actually pain. So all types of pain, you know, whether it's acute or chronic, Chinese medicine is really effective to treat. So, you know, I see, you know, different things like sports injuries, or, you know, from, you know, accidents, or just chronic, you know, injuries, or acute things, you know, acute pain, whether it's even an earache, you'll get relief, or toothache, headache, you know, that kind of thing, or to more serious things like frozen shoulder, or tennis elbow, carpal tunnel. So pretty much all types of pain, you know, acute or chronic, very effective for. Also digestive problems. So you hear a lot of people with digestion issues, IBS, acid reflux, you know, GERD. just kind of thinking what things come to me, but those are very common,
How about
problems that
something
can be
like,
treated.
say, diabetes or?
Yeah, things like diabetes, acupuncture will help in conjunction with like herbal medicine and dietary, advice. High blood
Heart
pressure,
disease,
yeah,
arthritis.
arthritis, yes. That falls I find that falls
Pain.
under pain, right?
Yeah.
So,
Broken bones.
broken bones, there is yes treatment for.
Just speeding up
but-
the healing process, or surgeries,
Yeah.
even if they.
Yep, absolutely for speeding up healing process for sure.
So it's not really competitive to Western medicine. It's
Not at all.
complementary. Or
Exactly. Yeah, very much. Yeah, very much. I mean, I am. Although I am an alternative, medicine practitioner, I don't discourage people to, work with Western medicine, but just kind of guiding them in what they need. Like for example, Western medicine is perfect for emergency cases. There's probably not as much as we can do for somebody who's let's say had a gunshot wound or something. I mean, we have what we can do as first aid, but Western medicine is probably best
I
for
think the
that.
distinction is, like Western medicine is good for trauma.
Yeah, exactly.
And accidents and,
Yeah.
and surgery
That's
and stuff
right.
like that,
Brilliant, yeah.
mechanical stuff,
Oh,
right?
absolutely, yeah.
Whereas but is not so good at treating, always dealing with the illness once it's developed. Whereas I think with Chinese medicine,
Yes.
you're preventing those things from
That's right.
happening.
Yeah, that's right.
Now all we got to do is, convince our medical systems like OHIP to realize that it's cheaper to prevent something than it is to try and cure it.
Oh yeah, yeah. I mean that's out there, and we're doing our best to kind of to let people know about the savings and the effectiveness.
Now, do you get involved with the herbal side of things as well?
Yes, I do actually. I've actually been trained in Chinese herbal medicine and also Western herbal medicine.
Yeah.
So just give people an option, which way they want to go. I mean, herbal medicine, is extremely effective, if it's, used properly and distributed properly.
No, I've heard stories that some of the herbs that are used in herbal medicine are being made not available through government policy and that sort of thing. Have you found that at all?
Yeah, definitely. In most cases, it's somebody will come out with a product and they'll slip in a Chinese herb or herb, and then they whoever it is, like the FTC or something, will make it like a big deal that they're using this herb, but whereas this same herb has been used for thousands of years and safe and effectively,
Exactly.
right? So it's more of, I think, more that pharmaceutical companies, or they find that we're kind of a threat to them, whereas we're quite small still, but trying to educate people that there is that alternative. So it's a shame that does happen, but as far as what we use commonly, it hasn't been too much of an issue as yet, anyways. But it is, yes, we do have that where we have that kind of battle, that we have to overcome. So hopefully, with the experiences of more and more of us, people who are using it, then we can overcome those
Hopefully.
obstacles. Yeah.
Yeah.
So we're very much about trying to educate people about what Chinese medicine can provide, or how it can help as a complement.
So does
to
one
medicine.
typically go for, or ideally go for, an annual Chinese medicine checkup, or what's the protocol there? And one of the things that people are afraid of, one of the big diseases are the C disease, cancer, and avoiding that. And so what is the take and approach in Chinese medicine, both in wherever you are, and how do we manage our health once we start?
Yeah, definitely. People will advise people to come in, on a regular basis, or we don't say really the annual checkup, but because it's very safe, and you can be even pretty healthy to get a treatment, and it won't it won't set you back or anything. It'll actually help improve your prevention, right?
Mhm.
So it all depends on the person's health goals. What are where do they want themselves to be in terms of health? If they want to be in optimal health, then we'll recommend them to come like a certain amount of time, right?
Is that like once a week, once a month, once a quarter?
Yeah, so that again depends on what the person's coming in for. So
Yeah.
for example, if someone is coming in for pain, then we'll actually have them come in more frequently at the beginning, depending also on how severe the pain is. If it's something really excruciating,
Yeah.
it can be 2-3 times in the week for 2-3 weeks, right? Until
Yes.
the pain starts to ease off. And then from there on, we'll just kind of wean off on the treatments to maybe once a week and then once a month, or, once every
Yes.
other month kind of thing. And then, after that, it depends on, what else they want to do to prevent, pain or prevent other things from occurring.
Yeah.
So it varies, from person to person and what their health goals are.
It's people as they get older, often they suffer through different things.
Oh, yes.
And they'll say, "Oh, that's just me getting older," right?
Yes,
I
definitely.
mean, I have that problem with my knees a little bit, in that when I'm riding my bike,
Yeah.
sometimes I can't give it 110% like I
Right.
used to, just because there's a little bit of pain in the knees. Is that kind of thing something that Chinese medicine can deal with?
Oh, definitely. Yeah. Because it'll help also prevent it from getting worse, right? You're treating the area, which gives your body the signals, okay, there's something that's happening here that we need to address. So definitely, I have people that come in every week to see me. They don't necessarily have anything even specific, but because they're, whether it's their job, if they're constantly straining parts of their body, it's a good idea to just, get, even a massage or some, cupping or something to help with the muscles and just improving the circulation in the body, like energetically and blood circulation. So yeah, again, it depends on what you're looking at as what your health goals are.
So I guess the first thing would be to come and just do a, what do you call that, an intake?
intake,
and
yeah.
you just kind of assess the person and see what they might need, and then suggest how often they might need to come back
Yeah,
to deal
yeah.
with whatever they need to
Exactly.
deal with, right?
Yep, that's right.
And you're in the Bloor and Kiel area?
Yes, so I'm in
How does-
the West End.
How does someone
space.
reach you? And
Yeah.
Well, I guess the easiest is by my cell number, which I can give it to you. It's
Please.
647 289
289
9565.
9565.
And do you have a website?
I do, but it's not 100%
Right.
completed right now. So I
Under
can-
construction, what's the name of
Under
it?
construction. It's Traditional Medicine by Mai-Yee.
Traditional Medicine by Mai-Yee.
Yes.
Is there a dash in that?
No.
MAIYEE.
Yes.
.com.
Right.
Great. Okay, Mai-Yee, thank you for this. And I don't know how long I have to leave these things in, but I yawned and something happened, so
Oh.
I think I better have a post-interview checkup.
Yeah, that's right.
I think you look great.
Anyway.
I
think
it's
it-
very creative.
I think, yeah, it looks like a good
And you were talking
decorative
about
piece.
orange, and they're orange today. An orange day, so you got orange noodles. Yes, yes.
There you go. You got what you wanted.
Well, thanks for doing this. It's
Oh,
awesome.
it's my pleasure.
And
It was a
I
lot
look
of fun.
forward to finding out what my day later today and tomorrow is going to be like, and
Good.
how this is affecting me positively. So thanks for coming in
Great.
today.
I would love to hear.
Thank you.
Thanks.
Okay, so let's take a little break. We'll have the Earth All Is Us music again, and then we're going to come back with Raymond Beauchemin with his book Everything I Own. So we'll be right back here on Liquid Lunch, thatchannel.com.